Hello everyone, and welcome to the Mental Health Commission of Canada's webinar series. Today we're focusing on integrating psychological health and safety in the workplace, specifically from the healthcare perspective, with our topic being Caring for Healthcare, Leading Change in Psychological Health and Safety. So just before we get started, I want to introduce myself. I'm Sandra Coppert, Director of Programs and Priorities at the Mental Health Commission of Canada. And I'm very happy to be hosting today's session and with the great speakers who I all know personally, all of them, and the great work that they've been doing. So very happy to be featuring that today. And just before we get started, I do want to go through a few of the housekeeping items, which most of you are already familiar with. First being that audio is provided in broadcast mode through your computer speakers. So you can hear us, but we can't hear you. This webinar is being recorded, and it will be posted on our website in the webinar archive sections following the presentation in a few weeks. If you would like a copy of today's slide deck, you can download it right now using the Files pod located at the top right of your screen. Select the item you wish to download and click Download File. I invite you to send any questions using the Q&A pod, which can be found on the bottom right of your screen. Questions posted in the pod will go directly to me, and we'll be able to review and ask questions at the end of the session, time permitting. Great. So before I pass things over to our guest speakers for today's webinar, I just want to help to set some context. So as many of you already know, at least 500,000 Canadians in any given week are missing work due to a mental health problem or illness. We also know that this is an underreported number. And if it doesn't affect you directly, it does through your families, friends, and coworkers. So this really is an issue affecting all of us and truly should be everybody's business. Fortunately, as much as there are a number of related issues related to this topic, we also know that there are a number of solutions, some of which are evidence-based and have been working for many organizations, including those in healthcare in the past few years. Our key focus is on the National Standard for Psychological Health and Safety in the Workplace, which, as many of you already know, and so we won't go into too much detail about what it is a voluntary standard from the CSA group. It's non-prescriptive and applicable to any organization. While it's not specific to any sector, we have found it to be effective across a variety of sectors, including healthcare. And while it's non-prescriptive and voluntary, fortunately it does help to provide that framework of what an organization can use to embed psychological health and safety within your workplace, as well as a number of tools and resources that even through us at the Commission and other sources out there have developed to help to support this journey. And we do like to emphasize that it is a journey. It's a journey of continuous improvement and looking to change the culture. So when we're talking about health and safety, we're not limiting the conversation or the focus on the physical health and safety, but also the psychological or mental health. And why are we specifically focusing on healthcare today? Well, while there's a number of varieties and challenges within different workplaces, we know that there are some specifically within healthcare, including some of the stats we have on the slide right now, knowing that through healthcare workers that they're 1.5 times more likely to be off of work due to an illness or disability, that burnout, fatigue, and other issues are very true with physicians, nurses, and other healthcare providers, and that other specific areas such as compassion fatigue and moral distress are also of greater concern within the healthcare sector. So implementing something like the standard or a framework for supporting mental health within an organization, specifically within healthcare, can improve patient satisfaction, reduce medical errors, reduce absenteeism and turnover, improve recruitment and retention, improve morale overall as well as relationships, boost productivity, enhance organizations' reputation, as well as looking at decreasing costs across the board. So we specifically at the Mental Health Commission, along with our partners at Healthcare Can, recognized that there was a need to do more, specifically within healthcare. So about over 2 years ago, maybe even 3 now, we did create the By Health for Health Collaborative, made up of over 20 health leaders from across Canada, to really help inform us and drive an action plan towards what could be done in support of the standard within healthcare to take sort of, I guess, these concepts and turn them into action. So with that, we really did truly rely on this collaborative to work together to not only inform decisions, but really to help roll up the sleeves and get the job done. And already seen some great achievements with more to come in the coming month or so. So with that, I'll pass things over to our guest speakers, first of which is Sandy Coughlin and Matt Snyder, who have been the member co-chairs of the collaborative over the 2+ years that we've been in existence, to talk more about this great work and why it's important and what we see moving forward. And then we'll pass things over to Dr. Graham Dixon to talk more about how aligning something like the standard, which is more generic, can be applied through healthcare and through the LEADS framework, and so how to lead through healthcare from that psychological health and safety perspective. And he'll speak to it much more eloquently than I will. With that, I'll first pass things over to Matt and Sandy.
Great, thanks Sandra, and a big thank you to everyone here for joining us today. We're thrilled to be able to share some of the great work that's been underway by the collaborative over the last 2 years. Over the course of the next few minutes, we'll run you through a number of items that are there to support organizations on their journey. So as Sandra mentioned, Sandy and I are the member co-chairs for this incredible group of dedicated individuals who represent a diverse cross-section of healthcare organizations. The collaborative 2016 as part of the continued partnership between Healthcare Can and the Mental Health Commission of Canada. So the collaborative is called the By Health for Health Collaborative, and it currently is comprised of 22 healthcare organizations from across the country who are all committed to advancing psychological health and safety in our sector. Each organization has a varying levels of commitment to and implementation, from organizations that are emerging and just beginning to adopt this standard to advanced champions who have had the standard in place for some time and have been able to demonstrate some of the successes around what it does and having it in place does for people. So the collaborative has a vision for healthcare workplaces to be leaders and role models in providing psychologically healthy and safe work environments for all Canadians. We have a number of goals. The first is to support collaborative members to implement the standard. So we do that through mentorship, sharing tools, resources, best practices, protocols, awareness, and we'll talk about a little bit about some of those things today. We provide strategic, or the next goal is to provide advice and strategic direction for systemic change at the national level. The third is to develop tailored and relevant tools and resources for the healthcare sector specifically. And the last is to work together to influence health-related organizations across the country to take action around psychological health and safety in the workplace. So with that, I'm going to pass it over to Sandy to dive a little deeper into some of those initiatives.
Thanks, Matt. And one thing that's important to note is that we've got to recognize that the work that's done and all the work that we're going to be talking about, that we're going to be rolling out, this has been done by collaborative members in addition to their day-to-day work. So and the results are just amazing, as you're going to see, but it is important to recognize people are doing this off the side of the desk because they're committed to this work. So the collaborative developed a 2-year action plan to advance psychological health and safety within the healthcare industry. The action plan that's been executed by 4 working groups. Measurement, because we all know if you're going to do anything, you've got to be able to measure it. System transformation, outreach promotion, and tools and resources. So this slide shows the activities and the results of each working group. As I said, measurement is really important because if you're going to do work, you need to be able to show the impact. And as we've worked across the healthcare organizations, we've got the 13 factors of the standards, but we also identified within healthcare that there are 2 other psychosocial factors that need to be addressed that are unique to healthcare. One is protection from moral distress, and the other one is support for self-care. Because we just can't make everybody healthy, but we need to provide them the ability to be healthy within a challenging industry. We are helping healthcare organizations assess their psychological health and safety efforts by designing a new custom survey and organizational review to assess the unique needs of healthcare organizations. And as Sandra mentioned, and we'll hear a little bit later on, that's going to be rolled out fairly quickly. preparing leaders to implement the national standards, the crosswalk between leads in a caring environment capabilities framework and the standard, and we're going to be hearing more from Dr. Graham Dixon a little bit later, and embedding this in accreditation. The standard is now recognized as an HSO leading practice, which is pretty darn amazing. And we are connecting with other organizations. We are discussing and partnering with the Canadian Patient Safety Institute and the Canadian Medical Association at this time. Now, Matt, you sit on the Outreach and Promotion Working Group, so I'm going to let you speak about that.
Thanks, Sandy. So the Outreach and Promotion Group has been working to promote awareness of the standard and the work of the collaborative in our sector, including why the work matters, and some of the supports that we have in place. So in essence, we know this works. We know adopting the standard will work and will do great things for people. So part of what we're trying to do is make sure everyone becomes aware of it, sharing successes, identifying why it matters, and what folks can do about it. So there are a number of different mechanisms that we've used for this. There's a LinkedIn group, and it's open to the public, so anyone who's interested in joining that LinkedIn group can just go on LinkedIn and type in psychological health and safety probably, and you'll be able to find the group name. We'd like to get more and more people involved in that. It's a great way to share information. We promote the standard and the work of the collaborative through a ton of different presentations, workshops, journals, articles, and webinars like this one. There's a new video that was created that shares some key messaging and helps others to gain buy-in. So the video is called Join the Movement, Advancing Psychological Health and Safety in a Healthcare Setting, and it is a specifically healthcare-focused video. And the other thing that we've done is celebrating commitment to our psychological health and safety. We created a declaration for psychological health and safety in healthcare. We're going to speak about this more over the next few slides. But in essence, it's a commitment that organizations can make to demonstrate that they are committed to adopting the standard and promoting it. So we have included a resource slide at the end of the deck with links to all the things that both Sandy and I are going to be talking about. And with that, I'll turn it back over to Sandy.
Thanks, Matt. Now, one of the big things around this work implementing the national standards of psychological safety in the workplace is, how do I do it? That's the biggest single question. How do I do this? It's very interesting work, but where do you start? Everybody knows it's the right thing to do. So what the collaborative has done over the last couple of years is that we've actually come up with a whole pile of tools and promising practices to be able to use. So that is very, very exciting. We've trialed it. We've gone through it all. We know these things work. And we will be, hold your breath, coming soon to a platform near you, free to everyone. We'll talk about it a bit later. Probably going to roll this out in the next month or so. But I will leave that to Sandra to address. But it is incredible. Here's the steps how to do it. So don't be worried about how to do it. We're giving you the resources.
Okay, great overview, Sandy. So earlier I mentioned that we were going to talk about the declaration as an initiative that had been led by the Outreach and Promotion Group. So the declaration was first launched by the collaborative at the National Health Leadership Conference in June of 2017. The declaration is a public commitment from healthcare organizations to show that they value the psychological health and safety of their staff and commit to taking action to improving their work environments. So, for those of you, you may wonder, why should an organization sign on to the declaration? So there are many reasons why, and I'm just going to highlight a couple of them. The first one is that you demonstrate your commitment to adopting the standard to your people. And this is huge. Remember that the standard, if you do the 13 psychosocial factors or now for healthcare 15, if you do those things well, you create an environment for your people to be psychologically healthy and safe. In essence, you create the environment in which they can thrive. And, help people get into healthcare, whether they're, primary care providers or whether you're somebody who provides support service like I do to those who provide care. People go to school for a long time, they work really hard, and they want to provide great care. And by adopting the standard, we created an environment that really supports and enables them to be their very best selves, that really enables them to be able to provide outstanding care. So we actually contribute directly to our mission by creating an environment that really supports and enables our people. through the creation of a psychologically healthy and safe workplace. The second thing that I'll draw your attention to is that it builds your employment brand by letting candidates know that you're the type of an organization that supports and enables its people. So just like marketing it internally to your staff demonstrates to them that you're committed to this, this is also one of the things that can differentiate you as an employer. Candidates will want to go work for organizations that care about its people and that take active measures to ensure they're creating a great environment for them. And then finally, as we mentioned earlier, healthcare organizations can be leaders in encouraging all workplaces to adopt the standard, which fits directly with our mission to really provide healthcare and create a healthy environment or overall health for our patients. We now have 43 signatories for the declaration, which represents almost 500,000 staff across the country, which is really an incredible number when you think about it. Our goal is that every healthcare organization across the country will sign on to the declaration, and everyone will take active measures to create this type of a work environment for their people. So I would invite everyone to watch our video that does a great job of explaining further why healthcare organizations should sign the declaration and why psychological health and safety in healthcare is so important. You can access the video on the Mental Health Commission of Canada's website or through the resources slides at the end of this presentation.
Wonderful. Thank you, Matt and Sandy. And I forgot to mention that Sandy is with Providence Healthcare in British Columbia, and Matt is with Peterborough Regional Health Centre in Ontario. And it's just such a true reflection. The collaborative is a national initiative, as mentioned also in partnership with Healthcare Can. It's a national organization, which is really remarkable, as all of you would know from a healthcare perspective, that it's rare that that happens, and really just to have representation from coast to coast to coast, I guess is what we say for Canada. And you'll see that from the other slide, and we have more information on our website about that. And just as sort of we're wrapping up our 2-year action plan and having a number of these initiatives already underway, or as Sandy mentioned, that we have a few more to come, which we're really excited about in terms of the assessment tool, which would be employee survey, as well as an organizational review of 15 factors specific for healthcare. We also see more work to come and how we can continue to support that work moving forward with the Commission in our new fiscal year. But just wanted to take a moment to really first acknowledge the collaborative, and those are just such a passionate group of people that really have made all of this come to fruition, as Sandy mentioned, on top of their actual jobs, is being able to take the time and commitment to do this, and acknowledging their organizations as well for enabling that to happen. And specifically my thank you to Matt and Sandy for their leadership and advice, and just again their passion for this to really drive it forward along the way has meant a lot to me personally, as well as to the Commission and the collaborative. And there's more to come, but I just wanted to take a moment to thank you for that. So with all of that love, I would now like to pass things over to you, Graham, and Dr. Graham Dixon. You feel free to further introduce yourself, but also just such a passionate leader in this sphere in terms of healthcare and working with leads, which he'll talk to in more detail, but how we've been able to now connect that to psychological health and safety and further help from a leadership perspective to understand that and further enable this culture change that we're talking about, and also just the way he's been able to embrace the psychological health and safety perspective and bring that to life in healthcare is quite remarkable. So I just want to also thank you for that, Graham, and pass things over to you now.
Thank you very much, Sandra, and I appreciate the opportunity to talk to people from all across the country about this amazingly important project. It's interesting, before the session began, many of you put up the jurisdiction in which you work, and I saw every single province represented there other than PEI, and maybe by now, since there's an extra 80 people, since that was closed, PEI is represented. And it's interesting, too, because the Leads in a Caring Environment framework, which is a framework analogous to the psychological standards framework for leadership in healthcare, is embedded in most of those provinces as well, which of course gave rise to this particular project. And the project that I'm going to spend a few minutes talking to you about, and we'll try to leave at least 15 minutes for questions at the end, is really the link and the relationship between healthy and productive leadership in our healthcare system and the standards that define a psychologically healthy organization. Because if indeed they were in conflict, I think we might have significant issues as we turn to people, particularly people in formal leadership roles, to be the champions of creating psychologically healthy workplaces. And it was in that context that Sandra and her team and the collaborative turned to me and said, look, can you take a look at what the standards and expectations of leadership as captured by the LEADS framework, and in the time we were doing this, the 13 psychological workplace standards, what is the relationship between the two of them? Are they in fact simpatico, or are they contradictory? And while you're doing that, Graham, would you please take a look at how might, if indeed LEADS is consistent with the standards of the standard itself, how might you use LEADS if you were formally leading this change in your department or your organization? How might you use LEADS to guide the process of change? So that resulted in a report, and that report is what I'm going to summarize for you now. I'd like to start out by just a very, very quick story. Sandra said at the beginning that almost all of us, either family members or ourselves or someone we know, has been affected by mental health. My story is probably similar to many of you, but the picture in front of you is of the Riverview institution in 1986, I think it was, that was used to house mental health patients in British Columbia. And I put that picture up because my mother spent many years in that institution. And as a young guy, 8, 9, and 10 years old, wondering where his mother had went, I spent a lot of time ruminating, as a child ruminates, on mental health as I understood it and as it played out in my mother's behavior, and then, of course, her treatment. Because when she went into the Riverview Center, the current treatment at the time was a shock treatment, electrical shock. And I can tell all of you that my mother never came out of that institution whole. She spent the rest of her life essentially in institutions, extended care homes as she got older. And none of those institutions truly understood both the challenge of mental health and how to deal with it effectively from an institutional perspective. And we've gone much beyond that now today by taking these issues into the community and working with people in a community context. But I'm still of the belief that much of the stigma around mental health in the minds of many people still wants to put it back in an institution. A lot of people still don't want to deal with it as it truly manifests itself in our day-to-day life. So for me, the opportunity to do this project had a personal link. It gave me the opportunity to explore my own internal landscape, my own internal views on stigma and beliefs about mental health, and the comfort I had with that particular topic. And I'm hoping as I go through this with you that it'll encourage you to do the same, I guess from two perspectives. Truly, do we own personally the challenge of mental health? Do we understand it as it motivates and shapes our own individual behavior? And secondly, as I go through this, if you are knowledgeable about the LEADS framework, think about the leadership expectations that framework has on those of us in formal leadership positions to champion the standard and its implementation, every facet of our organizational life. I heard it said before that many of the members of the collaborative do this off the side of their desk, and I thank them for that, and I say that's fantastic. At the same time, those of us who are in formal leadership positions in organizations, we've done this too much off the side of our desk. I think we need to make it front and center on our desk, and we need to know how, as a leader, to lead and champion this change. So with that introduction, I'm going to move us through the standard itself and its link to leads. And I show you this particular quote because I think, indeed, to be a true champion of what the standard represents in terms of what an organizational life should be like, will challenge the courage of all of us. Because the essence of leadership is courage, the willingness to take a current state and change it. That is demanded of each and every one of you, and certainly of me. So the challenge that I had, and that I'm going to spend the next 15 minutes sharing with you, was this challenge of connecting the frameworks. Are they similar? Are they different? Are they demanding of people behaviors that are inconsistent with one another? If they are, what should we do about it? If they're not, how can we leverage the potential in a leadership framework that says to people, this is how you lead effectively, and a psychological health and safety framework that says, here are the conditions that create psychological health in the workplace. So that's what this, the remainder of this presentation will focus on. There is a companion resource for today's session, and it is, as indicated earlier from Sandra, you can download it under the Files tab at the top. And as we go through it, by the way, I'm going to be highlighting some aspects in it. Do reflect, again, please, personally, on both your own personal attitudes towards mental health, and I know you may have done this a lot already, but do it again from the perspective of leading change. What do I say to others? How do I promote this in my workplace? What do I do to champion these standards and expectations, not in everything I do formally as I interact with people, but my informal interactions with people, my body language, the subtleties of my comments, the steps and the way I apply my time. Please think of that in terms of how does your leadership demonstrate commitment to those standards. The LEADS framework is a framework that, as I said before, is intended, as Sandra said earlier, as a set of voluntary standards to define the qualities, the capabilities of leadership needed in today's modern health system, which is suffused in the challenge of reforming itself to be much more patient-centered. That's not a minor tweak. It's a major shift of behavior, not only from the point of view of clinicians and others who deliver service, but certainly from the point of view of every single person who exercises leadership in that system. Putting the patient at the center, the mental health patient at the center of everything that we do, requires us to think differently and to act differently as a leader, and that's what LEADS is intended to reflect in its 5 domains and 4 capabilities. And of course we have the National Standard for Psychological Health and Safety that outlines 13 conditions that supposedly leaders champion in the area of responsibility they have with leading others. Any formal leader has people that report to them, that they interact with. They have peers that they interact with, bosses that they have to report to. And all of us have a workplace. We have a context in which we apply our leadership. And it's that context that these standards reflect and refer to. There are, in addition, two more that Sandra mentioned, and maybe I'll get her to remind us of what they are at the end of my session. So my job was to look at the link between these two frameworks. It was done in the context, and of course to do that job, I wanted to first understand the health context as much as I could from the point of view of mental health, and these two quotes are quite reflective and support what Sandra said earlier. For some reason, and it may very well be the caring and compassionate nature that demands on clinicians and nurses to be caring and compassionate, that creates the challenge of resilience and the challenge of responding to the needs of patients that are also really challenging for those of us who want to create psychologically healthy workplaces for those people to work in. Healthcare workers, as this slide indicates, are more prone for those reasons to suffer from these mental health conditions, if you like. Be they either very acute or they be in just the beginning forms. Remind ourselves that much of the service that we deliver is person-based. It's not technology-based. I don't go to the healthcare system, plug my MasterCard into a machine and get money out from a bank without interacting with I can do that without interacting with a person for months. If you're delivering healthcare, you're always interacting with a person. 70 to 80% of our budgets go to people. So it is more prone to these issues and concerns than many other workplaces might be. And it's sad in some ways that we haven't seen and devoted more of our leadership time to understanding the responsibilities we have to this very issue in our workplaces. Because if our workers aren't healthy, it's very tough to deliver caring and compassionate care to those who need it. The CSA standard itself outlines these 13 workplace conditions, and I'm going to very quickly just remind you of what they are, and as I go through them, please think of them in terms of a leader, someone who is responsible for a cohort of people and who is guiding them to deliver service. Are any of these conditions not relevant to that leader's job? It was very clear to me right off the bat that most were. Some may be more than others, but I would be very interested in knowing if, and you please feel free to put up on the chat box, if you see any of these that you think are completely inconsistent with a manager or a leader's responsibility in the workplace, let me know. Psychological support, organizational culture itself, which is a very broad term for the customs, beliefs, traditions, and ideas that permeate the organization and that drive people's behavior. And is that behavior characterized with civility and respect between employees, between clinicians and non-clinicians, between employees and bosses, between doctors and nurses? Is there a psychological job fit? Are we asking to do people work that they're psychologically capable of doing and comfortable psychologically doing? Does the workplace encourage growth and development, which is fundamental in a modern workplace, where the knowledge worker is at the center? If the knowledge worker doesn't have the opportunity to grow and develop, how can they possibly deliver modern service? Recognition and reward. Can one imagine that that is not the responsibility, be it formal or informal, of a manager leader in the workplace? To recognize when someone is going above and beyond? Or in the flip side, recognizing when someone isn't pulling their weight for the sake of the team. Workload management, interesting challenge in modern health systems. We have some people with direct reports of over 200 people. Are we doing them a disservice by asking them to take on that kind of responsibility? Engagement. Many of you probably are sitting in organizations that do engagement surveys. Do we truly take them seriously? Do we understand the factors, all of which, by the way, are part and parts of these CSA workplace conditions, that lead to effective engagement? Do we acknowledge the need that people have for balance in the workplace, work-life balance that differs from young to old? Psychological protection. You see the ads on TV almost regularly in British Columbia of the challenges that nurses are going through in terms of psychological and physical protection in our workplace. Are we conscious and aware in dealing with that? Do we create a supportive physical environment for people that have to do physical work? Do we have the technology and the supports that are necessary to help them in that regard? Because without that, that creates a psychological toll. And of course, in terms of the CSA standard, the last item and the one I'm going to spend most time on is the standard of clear leadership and expectations. And that's what leads us directly, explicitly to LEADS, because LEADS outlines what those leadership expectations are and the demands of a good leader, and how consistent are they with all 13 of these psychological workplace conditions that the standard relates. Interesting, because I spent a lot of my time reviewing the literature, and in the last 5 years, the literature is in this domain of psychological health in the workplace has really grown in terms of giving us empirical evidence about the impact that negative, narcissistic, abusive leadership can have in an organization. And I could tell personal stories about that, and I would bet that many of you can point to someone that has led you in the past that has maybe fallen into that category where they've created a toxic rather than a compositive psychological environment. The personality, style, and attitude of a leader has a huge impact on the comfort of speaking up and the modeling the behaviors that people should and could demonstrate to shore up and create a psychologically healthy workplace. And now the literature is showing us that toxic behavior can even trump the best policies and procedures. You may have the best policies around mental health in the workplace, but if an individual leader ignores them and behaves inconsistently with them, the impact of those policies and procedures will be absolutely inconsequential. They will have no impact in that person's area of responsibility whatsoever. In fact, they will be contravened. As this particular quote gives you, and if anybody would like more of these references, please feel free to contact me, and I'd be very happy to share them with you. So I should mention that there is a version of LEADS that is being used in Australia as well as in Canada, and it's very, very quickly. Just want to remind you that there are 5 domains of leadership in LEADS: self-leadership, engaging others, that means direct contact in the workplace, achieving results, which means we're not just paid to have good relationships, we're also paid to be productive, and therein lies some of the tension for leaders as it relates to creating relationships. We're also responsible in organizations for building coalitions, like the collaborative itself, which is a great example of a coalition for a purpose. And we're all responsible for transforming systems, which means creating the change, say, that the CSA set of standards says we should be creating in our organization. Those are the 5 domains, and there are 4 capabilities in each. When I looked at the two frameworks, compared their 13 workplace conditions and the language related to it and the documentation that was provided to me, and the lead's approach to leadership, one of the things that struck me very quickly was that there is a philosophical congruency between the two. Both emphasize caring for others. It is leads in a caring environment. And caring is the essence of psychological health. If the leader is seen to care for the worker, for the employee, for the doctor, for the nurse, and they for each other, then that will contribute to psychological health. Both are aspirational frameworks. In other words, rather than with a cudgel say you must do this, they lay out the highest level of expectations for psychological health in one instance, for leadership in another instance. And they ask people now, aspire to that. Be that. As Gandhi said, be the change you want to be in the world. But if you don't have a framework to aspire to, sometimes it's hard to understand what I should do as a leader or what I should do to create psychological health in the workplace. And both seek to shift cultures in the workplace. We're not trying to develop leaders simply for the sake of an individual leader. We want to develop leaders for the sake of the system. And we want psychological health and safety, not for individuals solely, but for a healthy and productive workplace where people go to work every day believing that they can truly make change in that workplace, serve patients to the best of their ability, and come home feeling personally fulfilled at their ability to do just that. When we looked at specifically mapping leads to the standard, what we did, and you'll see this outlined in the paper that you can download, and this slide is simply giving you an example. We took the standard, put them on the left-hand side, and we tried to show the leads elements, the capabilities, and specific and domains on the right-hand side that showed the relationship between the two. And all 13 standards are reflected in that particular way throughout this paper. The second part of the project, and I want to finish here in a couple of minutes, and I can't go into great detail on this, but I would hope that you have the opportunity to do that. You're at your own leisure, but is how to use leads to create change in a workplace. And we said essentially there's two ways. One is the leader manager must model what psychological health looks like. And if a leader, in fact, is someone who's on the far too right dimensions of the mental health continuum, it's really hard for them to champion mental health in the workplace. And maybe they need help, and maybe they need support and protection, which we're asking them to provide for others. We cannot assume that all formal leaders are themselves mentally healthy. And if you're really trying to champion these conditions in the workplace, you really need to know how healthy your management cadre is. Because when they leave your room and they go back to their workplace, they will indulge at their level of mental health with others. Very important to understand that particular aspect of leading change in the workplace. So leads is also a disciplined approach to leading change. So let's now say, all right, we've made the decision that we want to embed the 13 workplace conditions in our workplace, so we need to know where to start and how to go about doing it. You can use leads as a disciplined approach to creating that change. The following slide shows that we outline in this document, and we can provide greater detail if you wish it, the 7 steps that we suggest that a person should go through. And I hesitate to say steps because in reality there are 7 ways of practicing leadership that you must do, not necessarily in a purely linear way, but in an interactive way to create change over time such that those workplace standards, those 13 workplace, now 15 workplace standards, are in fact alive and well in your workplace. And only when you do that in a disciplined way can you be sure that over time they will indeed land and be implemented. The discipline of leads means you do it together, not simply the leader doing it by themselves. And that is an implicit philosophy in leads that it shares with the standard itself. So, in conclusion, and to allow time for questions, I'd just like to point out that the two frameworks are in fact incredibly complementary, and what it showed me by being given the opportunity to review the standards is that we in fact need to be far more disciplined in how we lead in order to create those psychological workplace conditions. And we can't do it off the side of our desk. It has to be right, front, and center on our desk as leaders if this is going to happen. So thank you, and I'm open to questions or comments, and back to you, Sandra.
Wonderful. Thank you so much, Graham, and thank you for your work on this and really bringing, like I said before, the standard to life even more so within the healthcare context, and for leaders of all kinds to embrace that moving forward, which is fantastic. And again, a reminder that the summary document related to Graham's presentation is available on our website as well as accessing through this as well. So great, we do have some time for questions, and just in follow-up to your presentation, Graham, there was a question online about if there's concerns, and this is open to the panel to address, is if there are concerns about taking something like a framework of the standard and also a framework from leads and kind of confusing that. Does that become a lot for people to process? I don't know if we have any experience or feedback on that yet, and maybe that's for you, Sandy, to...
Actually, I don't think that's one that, I think that's one that Graham might be better able to address, because we have already gone through our accreditation, so we're not looking at a different thing at the moment, but Matt, I think, has something to say about that.
Yeah, I think, you know, if you distill it down, the leads capability model really describes the how leaders do the things that they do. The standard, it describes the environment that we strive to create. So in essence, like as Graham said, they are complementary, because how you create the environment is really accomplished through the capabilities that are identified in the LEADS framework, and of course they can be developed as leadership can be developed. So I don't know if you have anything to add to that, Graham, or? Well, yeah, I mean, essentially I agree with you wholeheartedly, Matt, and my answer to anybody who asks me if they're, you know, if trying to, if you like, deal with two competing sets of standards is the person's view, I would say no, they're not competing at all. In fact, embrace either one. As a leader, if you embrace the 13 workplace conditions and you act accordingly to bring those about, you're acting in consonance with leads. If as a leader you choose to embrace leads to guide your leadership, be confident that you're now working towards the implementation of those standards. What I would suggest to either person, whichever framework wants to guide their behavior, is that they look to each of the frameworks for help and guidance about how to do it in a disciplined way. Mm-hmm. More often than not, we apply these ideas as intellectual comforts that we walk into our workplace with, but we don't turn that intellectual frame into practical action. And maybe that's the difference between leadership and non-leadership, is that leaders act. They are required to act. They can't just embrace a framework and say, I believe in this, and not act accordingly, because that'll just display them for being an inadequate leader in the first place. So the incumbency upon good leadership is to act commensurate with either framework. Great. Thank you, everyone, for weighing in on that.
Also, just in follow-up to your presentation, Graham, the two additional factors that we already mentioned, specific to healthcare that surfaced from our work, including research, so it is evidence-based, is supporting psychological self-care and how organizations can be better prepared and enabled to support this for healthcare providers themselves, as well as protection from moral distress. So the assessment tool related to that is, it's final. We're just working through the last little logistics to have it hosted online with the Canadian Centre for Occupational Health and Safety, so it is free and accessible for all. So we'll be happy to be sharing that hopefully within the next month or so. Some other questions that we have for the panel with the time we have left is, I'll throw this one to you, Sandy. And there was a question about how to build support throughout the different staffing levels within an organization, and if you have any recommendations or perhaps some examples for enhancing communication and trust.
So that's a really good question, because when people look at the national standards, they go, yeah, it's all the right thing to do, but how do we actually do it? And it looks like an enormous commitment. So you have to have your senior leadership supportive of this work. We did it within our organization by asking the question of staff around sick time. Why is it high? What should we do about it? And from there came information around mental health struggles. So you can approach it in a variety of different ways. It's the right thing to do. I think as Matt had said earlier in the presentation, if you do this well, you will become the place people want to work. So recruiting and retention is easier. People will feel healthier. They will be healthier. And it can take tiny little steps. One of the little things that we did in our organization, which, you know, has had a surprising impact, was in our corporate support offices. And corporate support often gets lost in the mix of clinical. So in our corporate support offices, we implemented a dog program. So people, it's very controlled, so it's not a doggy daycare, but people do bring, we have a schedule where people will bring a dog to work for a floor each day, and they're different. And it's had an enormous impact on the psychological health of our staff and the working there. So when you're looking at support, but we needed senior leadership to support even that. So it's looking at what do your staff need, what is easy to do, what is cost-effective to do, and really asking the question, how do we do this? But senior leadership is first, and then all the way down the line, what do you guys need? It doesn't have to be complicated or expensive.
Thank you, Sandy. Matt?
Sandra, can I just add one point to that?
Sure, of course.
I was reading a paper the other day written by someone who was analyzing a change in their organization, and the point that this person made, she was CEO of the organization, was that a number of leaders all nodded their heads at the table and then went out and actively, quietly worked against the initiative that had all been agreed at the table. And I think it is fundamentally important to remind ourselves that each person has a mind and each person has a motive. And the key to making anything work, and I would suggest that this particular commitment on behalf of a leader is one that requires formal, personal commitment. Whatever that is and how you need to have someone demonstrate it, I think it needs to be really emphasized. In addition to asking people to do it and getting them to agree to do it, I think it's important for them to ask them to truly look internally as to why they're doing it.
Well, and Graham, in addition to that, you do have to have a corporate policy that you all agree to. That's very important, and you have to have the training for your leaders to understand what this is about in order to put it forth. You have to get to the why of the work, so that is all very important pieces.
Great. So we have time for one more quick question, and I will pass it to Matt for this one. And it's just if you can provide any insights or commentary on resiliency and how we can support this within our employees. And that's kind of a bit of a buzzword these days too, but it is really important and part of this conversation. So if you could speak to that.
Absolutely. You know, there's a lot of discussion right now going on around resilience and what we can do to increase resilience within our workforce. as a preventative measure or also support recovery more quickly for staff suffering from things like burnout, compassion fatigue, vicarious trauma, second victim, PTSD, the various things that healthcare workers, frankly, just deal with as a result of the work that they do. And so, I think it's important to remember that resilience is something that's individual in nature. My resilience level around a particular thing is going to be different than someone else's. And, so I think everybody's different as it pertains to resilience. I think the second thing that we've got to remember is that resilience can be assessed and it can be developed. So it isn't something that's innate or that you're born with. You either have high resilience or you don't. It's something that can be developed over time, and there are various tools and approaches out there to both assess resilience levels in an individual as well as to develop it. So the final thing I would say around that is, the key to developing anything, and resilience is no different, is to practice those activities. So it's to support people to understand what resilience building activities look like, and then find ways to encourage them to practice them. Because the more you do something, the more you experience it, the better you get at it, the more comfortable you become, and it becomes just part of what you do. So, I think the advice I would give is to say, there's a lot of literature out there, and there's a lot of information out there on what you can do, and different solutions are going to work for different people. So I think, do your research, figure out what's out there, and then make sure it's available to people, and make sure they know what they're developing and why they're developing it and how it's beneficial for them. Because a lot of people look at this as, a flavor of the week kind of thing, oh yeah, I can't really develop that. Well, yes, they can, but they have to understand what the benefit's going to be for them, both at work and in their lives.
Well, I think it's also really important to acknowledge that in healthcare, we have a culture that accepts behaviors that would not be accepted anywhere else. And we have to change that. We would not accept someone screaming and yelling and spitting at us in a coffee shop, but we do accept it in healthcare. So we need to change that, and resilience is a big piece of that. So,
yes, thank you. There's still a lot more work to be done, but we are very proud of what we were able to showcase for you all today, and we've listed some of the key resources, all of which are available through the Mental Health Commission website. Wanting to thank Healthcare Can, who has partnered with us at the Commission on this work, and even previous to the collaborative. It's just been a great partnership in supporting this development. And again, I also want to thank the fantastic speakers who are just great colleagues and frankly friends at this point, and just the great work we've been doing together in really representing on behalf of the full collaborative, which is just a great group of individuals who are working together to do something on a national level in healthcare, as well as also, of course, that includes you, Graham. You're sort of an honorary member at this point. So thank you for sharing your work with us today, and we continue to look for ways to work together moving forward and sharing this great work with others. Just also quickly wanting to point out, in addition to the resources, that we do have our webinar series continuing, with the next one happening February 27th, as always the last Wednesday of every month. And as per usual, we have an evaluation to let us know how we did today, as well as feedback on future topics and anything else that you care to share. We're happy to hear from you. Also, just today is, being January 30th, is Bell Let's Talk Day, so that's something else that we at the Commission and through our other partnerships we strongly support, and and also commend Bell for the great work that they've been doing in this area for a number of years in support of mental health. And so get on the social media, use the hashtag, tweet away. You can just even retweet things that Bell Let's Talk is doing, or maybe through the Commission or others, whatever makes it easiest for you. But just wanted to make you aware of that, and to please support where you can. And with that, thank you everyone for joining us today, and I hope that you got something out of this and that you have a wonderful day. Thanks everyone.